Thank you for joining me, and we're going to talk today about the problem that occurs if you sip liquids, drinks, anything, even water, too frequently during the daytime. And many people are surprised because I think there's a big push today for children and adults to be continuously sipping water. And I know that we need to stay hydrated, but I want to explain the disadvantages when it comes to your teeth and specifically to the outside surface of your teeth, the tooth enamel. So when you sip water all day, you're going to see changes in the enamel. What you're going to see is that your enamel becomes thinner, more translucent is usually the question, the cry for help. Help, what do I do? My teeth are becoming translucent. And so we're going to cover that today. I'm also going to cover the value of the liquid in your mouth, the thing you probably have never thought about, the value of your own saliva. It's very easy to be sold on the idea you need nanohydroxyapatite, that you need some special mineralizing toothpaste, that you need to go to the dentist or have a cleaning. The secret to success is in your own mouth. It's free. And if you use it properly, your own saliva, it can repair and remineralize and do more for your teeth than nanohydroxyapatite ever thought about doing. And we can mention why I don't recommend that, why going for a cleaning at the dentist may simply make things worse for you, and why you need to try to self-diagnose, because very few people are looking at this as a problem. It's a symptom. It's a symptom of a problem, and you need to figure out why you have the underlying problem that's causing your teeth to be translucent. So we're going to talk about why this happens, how you can prevent it, the use of your own mouth liquids, your saliva, and the habits that you have that can either hurt you or help you. And that includes what you use for daily mouth care. So that's what I'm going to try and cover here so that you will get a full picture of what to do. And I would not immediately rush to the dentist, because if you do, they're most likely to want to either put a veneer on the outside of your teeth, to crown that tooth, or at very least to do a composite application of filling on the outside of your tooth, kind of a layer, to thicken your tooth up. That may look very nice, but that is not the natural solution for this problem. And if you don't get to grips with why this is happening, believe me, you will have put a Band-Aid over the initial issue, but you will find other things occurring in your mouth. You'll find your fillings starting to fall out. You'll find that your teeth start to erode. You may have erosion marks at the side of your teeth and be told you're brushing too hard, or you're grinding your teeth at night and they're wearing away. All of this comes under the same umbrella. So let's dive into that. What is that umbrella? Well, there are only two things that really damage teeth. One is acidity. The acidity in your mouth will pull minerals from your teeth. Sometimes in the form of a cavity, that would be a bacteria that produces acids, and the acids literally bore into the tooth. That's how cavities form. But in this case, if your enamel is becoming translucent, it's losing minerals from the surface. How would that be? Why would that be happening? Why are minerals being pulled out? Well, it could be the pH, the acidity in your mouth. Because if your mouth is a low pH, the minerals come into it to try to raise the pH of your mouth. That is a problem. So the length of time your mouth is acidic is the key. And I'm going to give you the quick solution right now, which is to stop that acidity being prolonged. When you eat or drink anything, whoever you are, the chances are your mouth will be acidic for up to an hour after eating and drinking. Dentists will tell you don't brush your teeth for that reason, because your mouth's acidic. They agree with me. I don't agree you should wait. I agree that immediately after that acidic attack of eating and drinking, you should take a Zelly's xylitol mint, or a mint that's made with 100% xylitol, because that mint, that xylitol in your mouth, will stimulate, pull a flow of the liquid in your mouth, your natural saliva. And when saliva is stimulated, that's what xylitol does. It stimulates this flow. Stimulated saliva knows it's got to do something. It knows it's an emergency. In this case, it's an emergency to stop your teeth demineralizing, getting weaker, and it will come into your mouth 2 units of pH higher than your resting saliva. That means if you're a woman, you're pregnant, or your hormones have right now in the cycle where your pH is very low, or you're stressed, which is another reason for low salivary pH, just your resting saliva is naturally, you can't do anything about it. It just, when you're pregnant, your saliva is going to be a pH of 6 for 9 months. Nothing you can do can change that, except take a xylitol mint and it will stimulate a pH that's closer to 7 or around 7. And 7.4 is ideal. And that is when the minerals will go back into your enamel. If people tell you minerals can't go back into your enamel, they don't know the pH issue, and they're not using natural saliva. Because in your saliva, in this natural liquid in your mouth, the minerals are literally dripping. It's super saturated with the minerals that are ideal for rebuilding tooth enamel. No, you don't need nanohydroxyapatite toothpaste at $25 a tube, because those minerals have been manufactured. They are not the same. They are not dripping out of your natural mouth liquids. And your mouth may not be at the right pH anyway. And it can actually make matters worse because it's almost like a Band-Aid over the outside. Your own saliva will naturally percolate into the areas of lower mineralization. They flow in between the crystals, and where there's a lower density of minerals, that's where they deposit. So it can get right into the very structure of your enamel. It's not a Band-Aid on the outside. So leaving your mouth to interact with stimulated saliva is the key. And you need to do this directly after every meal. And then don't eat or drink for an hour. This gives that whole process time to occur, to put the minerals back into your teeth. The other thing that happens is that xylitol is able to feed the good bacteria in your mouth. It actually makes plaque slippery, so bacteria start to disappear, and it's progressive. It usually takes about a month to get plaque off your teeth, and then it takes about 6 months to clean the saliva in your mouth. So you no longer have plaque bacteria floating around in your saliva even. And the cool thing is that when xylitol feeds the good bacteria and you have a flow of saliva, the proteins in your saliva will mix with these good bacteria and they will form a biofilm. This is almost like a thin fabric, a translucent fabric is the only way I can describe it. A mesh of good bacteria and proteins. And biofilm isn't something we're trying to remove. Years ago, in the old days, dentists thought all biofilm was infected. That is why your hygienist may refer still today, if she may have been trained before 2007, 2015, when the new studies came in. If your hygienist was trained prior to that era of the understanding of biofilm, she may still believe all biofilm is infected and needs to be scraped, cleaned, jetted, abraded. You need to get biofilm off your teeth. They use biofilm in the same context as plaque. I differentiate. Plaque is infected biofilm, and we can get rid of that infection with xylitol. Healthy biofilm is an incredible protective layer that needs to cover your whole mouth. We have biofilm on the outside of our bodies. We have biofilm everywhere on the inside of our bodies. It is our protective mechanism as human beings. And this biofilm over your teeth actually resists. It starts to stop the minerals from enamel from leaching out. So it's another way to stop your teeth losing minerals in an acidic environment. And that's very important during meal times. It's very important during the night when you're sleeping. And it's particularly important when you drink drinks. If you're sipping water all day long, even regular water, you are, first of all, thinning, diluting, and potentially changing the pH of your healing saliva. So you're making that wonderful liquid impotent, so it can't help you. But you're also washing away minerals from your teeth. And if you have lost this protective biofilm, then you're going to wash away even more. And people with translucent teeth, that's what's happening. And how do you lose this protective biofilm? Because you believe that you need to use baking soda or peroxide, or you have artificially whitened your teeth, either at the dentist or by yourself with white strips or other products, because the peroxide and the baking soda literally strip your teeth of protective biofilm. So also does having a cleaning at the dentist. They will usually use products, unless you ask them otherwise, that are sufficiently abrasive or baking soda to strip away biofilm because they're still living in the past. They still believe that your mouth is infected and that you need to remove all biofilm. The secret to not having a cleaning is to ask your dental professional, do I need a cleaning? If you're using my strategies, if you're using the xylitol in the way I recommend, if you're not eating and drinking between meals, you will develop healthy biofilm. Why would you want to clean that off at a dental cleaning? Nothing is infected. There is no calculus. There is no tartar. Why would you strip that off your teeth any more than why would you take an antibiotic if your gut is healthy? You wouldn't want to lose healthy biofilm. And I have had my mouth, my own personal mouth. I did this experiment 40 years ago, wondering how long could somebody with a healthy mouth go without a cleaning? And I would have evaluations, because you need evaluations. You need to go to the dentist and find out if your teeth are healthy. Ask them, do I need a cleaning? And I have done that now for 40 years. And only last year was told, no, you don't need a cleaning. My teeth are clean clinically because they are covered in healthy biofilm that helps protect them from mineral loss. So it's a new concept. It's something you'll need to work with your health professionals because they may not understand where you're going. I have a book called Mouth Care Comes Clean that specifically addresses all of this biochemistry. And you may want to go through it slowly and learn more. Again, my website, drellie.com, is a resource for not only the complete mouth care system that I recommend you care for your teeth twice a day. They will help speed. These products don't do anything more than help speed the reabsorption of minerals into your teeth. If you go to an average dentist and ask them, what do these products do? They'll look and be confused. But if you learn how to use these products and why, you will understand how they help you speed the mineralization process so that you don't end up with demineralized teeth that will fracture, break, crack, and generally cause you more future dental work down the road. So yes, you do need to do something about your translucent teeth. I'd recommend that you spend 3 to 6 months following the recommendations on my website at drellie.com. If after that time you still feel your teeth are not strong or they're likely to crack or break, then you should you put a crown on that tooth in order to preserve it. Some people's teeth are so damaged, that's the only option that they have. And I will end with a story, because this story began in the 1980s with a restaurant crew that I was helping to keep their teeth healthy. And one of these waiters, this was before the era of today's whitening products, and he decided he would use Comet Cleaner, which is a very toxic bleach for cleaning your kitchen sink, that he decided he would use on his teeth to whiten them. And he was able to so demineralize his teeth that, to me as an observer, he wasn't my patient. He was just somebody I knew. And I would say to him, Rodney, your teeth are going to crack off if you keep doing this whitening treatment. You are stripping your teeth of biofilm. You are damaging the enamel. It's becoming so fragile, it's going to break. And one day when he was doing something, a little piece fractured off. He was then scared. He got on this system that I've explained to you today. The cool part of the story is that 2 years later, he slipped on ice and hit his entire upper jaw on a railing bar, and nothing fractured. In other words, his enamel had become as strong as this iron bar and was able to resist the impact. That's how strong healthy enamel is. And you can do a Google search. Put a Google search, the strength of enamel compared with steel, and you will find they both have a Mohs hardness number of 5. This is why you don't have to be afraid of brushing your teeth. You won't brush your tooth enamel away. It's not your enamel that's weak. It's how you take care of it.